Have you ever wondered why your doctor asks you to check your blood sugar even when you don't feel sick? You may be surprised to know that blood sugar testing is one of the simple tests healthcare professionals use to get important information about what's happening inside your body. So, what exactly is blood sugar? Blood sugar, also called blood glucose, is the amount of glucose circulating in your blood. Glucose is an important source of energy for your body, and much of it comes from the carbohydrates in the foods you eat. Your body normally keeps your blood glucose within a certain range using hormones, especially insulin. But when the system isn't working properly, your blood glucose can become too high or in some situations too low. So why would your doctor request a blood sugar test? One major reason is to check for diabetics or pre-diabetics. Your doctor may also request a test if you have certain symptoms such as increased thirst, frequent urination, unusual tiredness, blurred vision, or unexplained changes in your weight. But here is an important thing to know. You can have abnormal blood sugar levels without obvious symptoms. That's one reason routine testing can be useful, especially when a healthcare professional believes you may be at increased risk. Blood glucose testing can also be used to monitor someone who has already been diagnosed with diabetes. It can help healthcare professionals assess how blood glucose is being controlled and decide whether further evaluation or changes in management may be needed. There isn't just one type of blood sugar test. For example, a fasting blood sugar test measures your blood glucose after you have not eaten for a specified period, usually at least 8 hours. There is also a random blood glucose test which can be performed without requiring you to fast. Another important test is the HbA1c test. Unlike a single glucose measurement, HbA1c gives an estimate of your average blood glucose level over approximately the previous 2 to 3 months. There is also an oral glucose test or OGTT, which looks at how your body handles glucose over a period of time after you take a measured amount of glucose. So if your doctor asks you to do a blood sugar test, don't immediately assume that you have diabetes. A test being requested does not automatically mean that diagnosis has been made. Your healthcare professional needs to interpret the result in context. They may consider the type of test you had, whether you were fasting, your symptoms, your medical history, medications, risk factors, and sometimes other laboratory results. And that's why it's important not to look at one number on laboratory report and diagnose yourself. If a result is outside the expected range, your healthcare professional may recommend repeating the test or carry out additional tests before making a diagnosis. The important thing is this: don't ignore a test simply because you feel perfectly fine. Some health conditions can develop quietly, and laboratory testing can provide information that isn't obvious from how you feel. So the next time your doctor requests a blood sugar test, remember that they are not simply checking a number. They are gathering information that can help them better understand your health. And if you ever receive a blood sugar or HbA1c result you didn't understand, don't panic. Ask your healthcare professional to explain what results mean in your situation. Follow Victor CC Hub for simple healthcare and medical education explained in a way that's easy to understand. And remember, understand your health, protect your future.